So what am I really excited about in terms of breast cancer treatment? At the moment, the new drug capivasertib that has recently been approved for use around the world, but including in the UK. This is a drug that targets a particular mutation in breast cancer cells called AKT1, and it is a drug that we developed. I led on the clinical trial in phase 2 in Manchester, and then that was taken over for the phase 3 development, recently approved, and is for women with estrogen receptor positive and HER2 negative breast cancer. Significantly prolongs the time that the cancer is controlled, and we think is highly likely to improve the survival of those women as well. At the recent ASCO meeting in Chicago, there was some really exciting trial results. One of those was Destiny Breast 09, looking at women with hormone receptor positive or negative, but HER2 positive breast cancer, and looking at the very first treatment that those women had for their cancer. The standard treatment is chemotherapy, pertuzumab, trastuzumab, which gives around about a 2-year control period, but the new drug, Enhertu plus pertuzumab, gave nearly 3.5 years of control, and it was better tolerated. So that was a real advance, and we hope to see that coming into the clinic in the relatively near future. So, circulating tumour DNA has recently been approved as a way to test for eligibility for 2 new drugs, so elacestrant and also capivasertib. So this is a real advance that we can now do the testing on a blood sample rather than having to do a biopsy of an area of metastasis. So this is really something that's going to be taken forward now for patients in the NHS. And perhaps even more exciting is that this type of technology is something that we will be using in the future to monitor disease. So it's a great step forward for us in the UK to have this available, and something I think we should all be very proud of.